In a second, I'll start going through the slides. But before I do that, let me just say that coming out of the questions last Wednesday, and also looking over all of the questions that have come in since Wednesday, what I'm noticing is about 7 different main categories of questions that people are most curious about in terms of our plan opening up in September. The number one question is for people coming in person. What does our plan look like in terms of social distancing and wearing of masks, especially when it relates to the classroom spaces? Although there are lots of questions about all of our spaces, of course, but people are particularly interested in the classroom spaces. The easy answer to that question is that while we're indoors, everybody will be wearing masks, and we will be practicing social distancing. We're going to be using our classroom spaces, and use as many of them as possible, and spread students out as much as possible. We're looking at spreading people out by at least 6 feet. Everybody should wear a mask while they're indoors. One of our biggest conversations is about our youngest students, the students that are in pre-K, K, and 1, and what's the realistic expectation for mask wearing for our little ones. And our approach to, just to put it out there, our approach is going to be to teach them about mask wearing, to practice mask wearing, but also to understand that students at that age, it might not be realistic to expect that they're going to have their masks on at all times. And so we're going to, the teachers in those classrooms will be making their own judgments about what's reasonable to ask and what's not reasonable to ask. We don't want to put a small child in a situation where somehow they're in trouble if they can't handle wearing the mask. So we're aware of that. We can talk a lot more about that as the hour goes on. Our second main question that I'm seeing is questioning about the way that we're going to be doing the daily screener of symptoms. Every single person that wants to attend in person each school day will have to go through a short series of questions and do a temperature check. So we're going to use a tool to be able to help us do that and collect the data every day. It would be so much easier and better if the screening happened at home before people came in. And so we'll have a mechanism to be able to collect the data about people that have cleared the screening, either yes or no. The questions will essentially be, do you have any concerning symptoms? Have you knowingly been in contact with anybody who's had a positive case, or have you done traveling into any of the hotspots recently? And then finally, the last thing will be the temperature check. Mandated by the state is that there's going to be a threshold of 100 degrees. If your temperature is below 100, then you're cleared to come in. If your temperature is above 100, then you can't come in. That also goes for getting on our school buses. So we have a pretty detailed plan about how we're going to manage all of that. As you can probably imagine, there's a lot of details to that one. But the thing that you need to know is we can't put anybody in a school space unless they've cleared the screening tool. So part of my slides are about the screening tool, and I'll talk a little bit more about that later. We do have a lot of questions about what the expectations are for both staff and students if they're going to be doing the remote side of our hybrid model. So if they're going to be working from home or if they're going to be learning from home, I'll address that in a little bit more detail as I get through into the slides. But essentially, lots of questions about our specialized classes. What I mean by that are, our upcoming school year can't be the same as what we had in the spring. So we've got adjustments to that plan. Lots of questions about our specialized classes. What I mean by that are PE classes, music classes, art classes, classrooms that are heavy on the material use, more hands-on kind of classes. All of of these have got some specialized considerations that we have to take into account when we make our plans. And so we've been thinking about those, and I'll talk about those a little bit. Number 5, people have been asking a lot about meals, how we'll serve meals, both breakfast and lunches in our buildings. The short answer there is that we want to use our cafeterias as much as we possibly can. We also will hold open the possibility of doing some eating outside, so that we know that while people are eating, they're not wearing a mask. And so in our cafeterias, we're going to put into place extra social distancing and really monitor the numbers of people that are in the cafeteria at any one time, so that we have a good, safe plan for that. We had briefly talked about the idea of serving meals in classrooms, and we've sort of gotten away from that now. There was enough concerns from enough people that we've shifted our plans over now to where we want to try to use our cafeteria spaces as much as possible. Question number 6, big question number 6 is about what are we doing in terms of our disinfecting protocols in our buildings every day? What are the routines going to be like? What can people expect? Will we ever ask kids to be doing any cleaning? The answer to that question is no. And so the promise that we will make is that for every single space that holds people in our buildings, that space will go through a disinfection every single day between school days. The follow-up question to that is sometimes about what about cleaning during the day? For example, if one group moves out of a room and another group comes into that room, will there be disinfecting in between those times? What we can say is there won't be the cleaning crew that comes in for that, but the person that's in charge of that room will always have cleaning supplies where they can wipe off handles, doorknobs, surfaces, etc. in between sessions. Finally, the last big broad category of questions is about our air circulating system, the heating, ventilating, and air conditioning system that we have in the building. We've got 2 pretty large buildings. Each of those buildings has had additions over the years. So parts of the buildings are older than other parts of the buildings. There's several different kinds of air circulators that operate in different spaces in the buildings. And so we've had a fair number of questions about whether the air circulating system is keeping everybody safe, could potentially be contributing to transmission of the virus. And so we're working really hard with the facilities people and the experts on those to answer all of those questions. Again, the short answer is we have a safe system. It draws from fresh air year-round, even in the coldest months. It takes in about 10 to 20% fresh air. And we've been chasing down all the questions about the filters in our systems and the pressure in the systems and all of the combination of HVAC experts with epidemiology experts to try and get the best possible answers to those questions. So that's a little bit of preview about the big questions. I'm going to switch over to my slides right now so that I can start sharing those. HVAC experts with epidemiology experts. For my helpers that are on this meeting, my question to you is, are you seeing the slide presentation on the screen?
Yeah, Steve, we can see it. Getting messages right now that there's a little bit of an echo. We let CTS know, and Stacy was just signed in at the same South Seneca Open as you, so she signed off. So hopefully that'll start to help clear things up. Yeah, okay. Steve, we can see it. That's good to know. Getting messages right now that
you can see the slide though.
Yes. We let reopening plans know, and
yeah. Okay.
Stacy was just signed in.
So I'm going to let our background people try to deal with the echo.
So hopefully that'll
if my helpers could mute their mics, that could probably help.
All right.
Let me just quickly go through some of the introductory slides here so that I can make sure that I'm spending most of my time addressing the questions that have come through. As everybody knows, that the governor has now indicated that schools are clear to open in September for in-person instruction. That decision is now a local decision. It's fair to say that almost all the public schools in the state are on some version of a hybrid model. You might be reading in the newspapers that there are certain local decision. It's fair to say that almost all the public schools in the state are on some version of a hybrid model. You might be reading in the newspapers that there are certain bigger districts that have made the decision already to go fully remote for the first part of the school year. And as we look around at our regional data, we feel like with our population size and with the situation in Seneca County, that we're still safe to be able to do the hybrid model that we've been planning. Nationwide, not so good news, but more locally, the news is better. As I mentioned, that the governor has indicated that schools are clear to open, but we have to monitor the local data. Otherwise, we get shut down by the state, which won't be a local decision. At South Seneca, we are tied to the Finger Lakes region for New York State. As of today, the Seneca County itself is reporting only 2 active cases. And as of August 10th, a week ago, this is the look at the regional chart from the New York Forward website. We've been sort of hovering a little bit under a 1% daily infection rate. That's a rolling 7-day average that's calculated by the number of tests compared to the number of positive cases. And so a little bit under 1% of people being tested in our region are testing positive. And so that's a level of infection that will clear us to do our plan. We do know that BOCES, TST BOCES, will be offering their programs 5 days a week in person for those who choose that option. They also are running a hybrid model so that they will also be giving people the option of learning remotely instead. So anybody that's a South Seneca student that's in one of these BOCES programs does have the ability to go to their program in person if that's their choice. As of today, on the question of sports, there are no interscholastic athletics allowed in the state. The governor in July cleared the way for some community organizations to run some sports. Some sports are approved and some aren't. But as far as school-sponsored athletics, we can't do anything. Even with the smallest groups, we can't put a coach with a small group. We can't do team activities. We can't do workouts. All of that is subject to change. There is a statewide organization that's dedicated specifically to New York State public school athletics. They have a task force, and it's their job to continue to monitor all of this and to communicate new decisions. But everybody should know that as of right now, we're completely barred from any sponsoring any sports activities at all. You may be aware that we've allowed the Seneca Falls Little League to use our Interlake and Diamond for their practices. And Four Towns has just opened up signups for soccer in the fall. Both of those entities, we've made legal agreements with them, and their agreement is that they run everything. And from our side, we can supply them with the fields. We can allow them to use our fields. But the understanding is that the school has no role whatsoever in any of the organizing of it. And that's just the situation that we're in until things change. There was a question I saw just before I came on about allowing groups to use our facilities indoors. And as of right now, that's not in our model. We're doing a very cautious reopening in September. We want to work out all of the details of the people that we have in person during the school day before we even consider opening up the facilities to outside groups for now. Another one of the requirements from the state is all of these rules about social distancing. wearing of masks. There are a few little exceptions to that. And the system that we have for monitoring symptoms, doing that daily screener, but also what's going to happen when we see symptoms or when we have a suspected case or a confirmed case. And we'll talk about that a little bit farther along in the slides. Some things that we still don't know, even as of today, August 17th. We don't know yet what the situation and the data is going to be as we get closer to September. And one of the things that's on our minds is the fact that the higher ed institutions, the colleges and the universities, are bringing students back at the end of August. Some of them are coming back already. And it's going to mean that there are going to be thousands of more people coming in from all over the country and even the world to our region. And we're going to need to pay a close attention to what that does to the data in the region in terms of daily infection rates. The worry is that there'll be a big spike in infection rates just at the moment when we're about to open up in September. And since we're tied to the greater Rochester area, we have to be concerned about that. So we'll keep an eye on that. Another thing that we don't completely know yet, but we're getting closer and closer to this number, is the specific number of staff and students who are going to be reporting in person in September for that part of our hybrid model. It's a really important number for us to know. I've been describing it a little bit as the chicken and the egg syndrome, where we ask, will you be coming in person? And the response we get back is, I can't tell you yet because I don't know what your plan is yet. And then part of our response back is, we don't know our plan yet until we know how many people we're dealing with. And so it's been a little bit of a circular process, but as we get closer, we've got pretty decent estimates of who we're expecting. And so this plan is now getting all of the details that it needs in order to give people give people enough information to make a fully informed decision. Part of that also is figuring out who's going to be riding school transportation. So we've been asking in our surveys, not only if you're going to be coming in, but would you be willing to transport yourself, or do you need the school transportation? And once again, knowing that is going to help us put together a better plan for the transportation piece. I won't linger on this slide. It's just a basic one. That's the way that our plan works. It's meant to be flexible. We described 5 models. The idea there is that if the circumstances change, then we'll be able to pivot from one model to the other. It's in red on the cover sheet there, and it's also right up at the top of this slide. Every bit of our plan puts health and safety first. So we feel like we're going to have a safe plan for people to come into the buildings. We want to guarantee as much possible safety as we can, and understanding that while the plan is very good, there's no way that we're going to be able to promise that there'll be zero transmission of the virus because of the nature of the virus. And so this is why we're asking people to try to make their own judgment call about whether they feel comfortable enough to report in person. Model 4 is the one that we're going to start with in September. This is the hybrid plan. Some staff and some students will be in person. Some will be working from home. We're building the entire thing to accommodate either option. For pre-K through 6 students, they'll come in 5 days per week if they choose the in-person option. For 7 through 12 in person, we will split the population so that they come in, depending on their program and depending on their needs, between 2 and 5 days per week. Any staff member that's coming in person just works their normal work week. We got 2 different questions that ask the same thing. Why is it that we can offer a 5 days per week system for pre-K through 6 and call that safe, but we're only going to use half the students 2 to 5 days per week in grades 7 through 12? And so there's a couple of different ways to answer that question. One thing is that what we recognize for the urgency to reopen in terms of our younger students is a little bit of a dire need on the part of some families for their young children to be someplace while they're off at work. We're finding more and more parents are going back to work. They need a place for their children to be. We have always provided a place for their children to be. We have the SAFE program, we have our school program, and it's comforting for families to know that that's taken care of. And so when we put this plan together, we really wanted to incorporate the idea that you can count on us for your younger kids. For the older kids, they're a little bit more mobile, they're bigger, they have bigger lung capacity, they're moving around more often. One of the things we know is that we don't control anybody's actions outside of school, and so the nature of teenagers, they're off at work, they have different activities themselves, and so it's the general consensus around the state that it's better to put together a hybrid program within your hybrid program for the secondary students, and we agree. We feel pretty good that with the capacity that we have in the Ovid building, we can accommodate the sixth graders 5 days a week. But for 7 through 12, we're going to build a specific schedule for them where they're in a little bit less in the building, on a daily basis. If they need more, we'll give them more. If you're part of the BOCES programs, you might be in that 5 day a week per category if that's what you choose. But we can make those things case by case conversations. As we've been doing all of this planning over the summertime, one of the heaviest lifts in any department other than the instructional departments is in our facilities. I've said many, many times publicly that schools are really not built for social distancing. We're built for the opposite of social distancing. We have classrooms where kids are encouraged to move around, interact with each other. We run after school programs, we run athletics programs, we have assemblies, we have morning forum in the middle school. Everything that we've built over the years is built for human interaction, person to person. So for us to pivot now and try to offer school where everybody is distanced from one another is a completely different scenario. And so, we've got a lot of work to do to be able to accommodate that and to be able to plan for that. Part of that is providing people with masks if they need it. Nobody has to have their own mask. You are allowed to have your own mask. You're encouraged actually to have your own mask. New York State isn't very particular about the type of masks that are available. We're just starting to see some newer studies that suggest that some masks are a little bit better than others. But we at school have ordered thousands of both cloth masks and paper masks that we'll be able to distribute to people. The paper masks are disposable ones. The cloth masks are meant to be reused. We do have the capacity to launder the masks if a family needs us to do that so that we can do the cleaning of the masks. We won't have a system where a person turns in a cloth mask and gets it laundered and then receives a different mask back again. We'll do a labeling process so that if we take your mask to launder it, we'll give you the exact same mask back again. So that's just part of the safety plan. You can see in this picture on this slide that we're beginning to install physical barriers like you see in banks and grocery stores. We're installing those in our office spaces, library circulation desks, some of the other high traffic areas. You shouldn't expect to see these things in every single classroom. We're not at that level, but we're trying to be thoughtful about where we're going to need these barriers for sort of the higher traffic areas in the buildings. We are doing upgrades to HVAC, including the filter system. You might have seen in the news conversation about the level of filters that are necessary for like the indoor malls to open. And so we've been working with all of the experts in HVAC and the health and safety people through BOCES who oversee our buildings' health and safety with the facilities department to make sure that we're doing all the upgrading that we're supposed to do so that we've covered all of those things. Back to that question about the system itself, we're kind of chasing down the questions right now related to movement of air. You may know that one of the issues with this particular virus is the idea that it can be aerosolized in the air. And so if there's a danger that people that are unmasked, that they could transmit the virus by breathing into the air, and then it hangs in the air and remains in the air. This is the kind of thing that we have to pay attention to when we're talking about our HVAC systems. We've got questions from teachers about whether it's a good idea or a bad idea to have the windows open, whether it's a good idea or a bad idea to have fans that like box fans that just circulate the air. And so we're trying to get all of the proper answers to those questions so that we can create the safest environment indoors that we possibly can. We got furniture considerations. We're set up for interaction. So we've got lots of classrooms that have tables in them that are designed for kids to sit together. We've got classrooms that have carpeting and rugs on the floors. So we have to think about all of those things and possibly move furniture out and move other furniture in so that we can accomplish the social distancing. We will be putting a lot of signage in the building to remind people about hand washing procedures and hygiene. And we're going to use hallway tape just really to create lanes in the hallway, encourage people to walk to the right, stay distanced as they walk through the hallways. We're not going to have 1,000 arrows and tape everywhere, but in the hallways, we'll create these lanes. Everybody that works in the building will be supplied with personal protective equipment as needed. Some particular job descriptions will need enhanced PPE. Obviously, the school nurses will need that. Maybe the food service people, some of our cleaners might need that. And then there are other specialized areas where we'll be providing enhanced PPE just on top of the regular face coverings. And then finally, I mentioned that different classes are a little bit different. So we're scouring all of the literature on PE classes, music classes, art classes, any guidance that we can get, we're incorporating it into our plans. And we're encouraging the teachers in those spaces to make specialized orders as they see fit. And we'll do everything that we can do to fulfill those orders so that we, again, have the safest environment possible. I just want to show this slide quickly. This is our academic calendar. We are a public entity. And so every single year, we have to account for 180 school days in the calendar in order to receive our state aid. If you've paid attention to any of our budget presentations, you know that our revenue comes partially from taxes of the community. That's about $8 million in our revenue budget. And then the other $17 million comes from state aid. We only get the state aid if we follow all the state rules. Part of the state rules is to create a 180-day calendar. This is our calendar for the school year. And what it does is it accounts for our school days. So all the days that are on this calendar that are designated as a school day, if you're a remote learner or if you're an in-person learner, that's a school day. And then we also have all of the regular days that we have that are off in the calendar, which are still, as of right now, off days. You all know from our experience in the spring that sometimes these things can change, but we go into our school year using this calendar to define our school days. And so our plan is to get rolling right away, September 8th, first day of school with in-person students. September 3rd, the week before, is actually the opening of our academic calendar for this year. That's our first superintendent conference day for staff. This is a little screenshot of the screening tool that we've chosen. We're going to use the screening tool that Cayuga Medical Center uses. The reason that we chose this one is because we match with most of the other TST BOCES schools. So we'll all be using the same screening tool for the most part. Again, I mentioned it before, but I'll say it again. Ideally, you do the screening at home before you come in. We'll have a system in place to receive the results of the screening. It's mostly an email-based system, but for people that struggle with the email or can't do the email, we can accept the results by phone. And there will be people in our buildings that'll be monitoring this every day, and then also addressing the ones that haven't yet done it before they get on the bus or come into the building. We'll have to do the screening there, right there and then. But we don't want to create bottlenecks in the building, so we're hoping that everybody can do it at home. If you get a green light on the screening, basically if you answer no to the questions and your temperature checks out, then you're cleared to come on in. If you say yes to one of the questions, or if your temperature is too high, you'll get a red in the screening, and you won't be able to come in that day. The nature of this tool is if you pass the screener the next day, then you can still come in. The only caveat to that is if you get a red and you don't pass the screening, there is the potential to do a follow-up with you. You can do it on your own, or we can make it happen for you. And if we have symptoms that we're concerned about, we can hook you up with the network coming from Cayuga Medical Center, maybe a telemedicine visit. We realize that there might be costs associated with that we should account for. We don't want anybody to incur a cost to walk through our process. So we'll work with families on those things. But this is really the basic screening tool. On Wednesday night, when I did this live for an audience, I got a fair number of questions about the self-reporting nature of doing the screening tool from home. And we all realize that there's a bit of an honor system here for this screening tool. For this one gateway piece, if somebody decides to just send in the answers with all yeses, including the temperature, and they aren't being completely honest about it, there's no way for us to catch that in the moment. What we can do, though, is we can guarantee that nobody will come into the building unless they've cleared the screening tool. And the first step is this tool. Once they get in the building, we'll have lots of people that are going to be paying attention to symptoms, monitoring symptoms, and we've got a plan that I'll share towards the end of this about what happens if systems present during the day. Quickly on the buses, the transportation system. I borrowed this graphic from Dryden School because our plan is the same as their plan. Whenever possible, we'll have windows open on the bus to circulate fresh air in the buses. We've been encouraged by the health departments that if we have a plan where we keep one child to a seat and put them by the window with masks on after they've cleared the screening tool, that's a safe plan. It is possible for you to sit next to somebody that's already in your own household, but otherwise it'll be one student per seat on the bus. This is a bit of a relief for us because early on in the guidance, it was suggested that we might have to spread kids out on the bus 6 feet, in which case we felt like we could only get about 8 kids on the bus, and that plan was really going to be a tough one for us. But if we can fill every seat, it's up to about 22 students on a bus, and we should be able to work with that. Again, the health department assures us that this is a safe plan as long as we follow the rules, as long as we keep the masks on while we're in there, and as long as they clear those screenings ahead of time. So let me just linger on this slide for a moment. These numbers here are very, very rough numbers for our best estimate of what to expect for students reporting in person based on the survey results that we have. Out of this entire plan that we've been building this summer, it's these numbers that really make us feel as if we can manage a plan that's going to be safe, because we're already a small school. our class sizes are not that big. If we remove the kids that are reporting that they're going to be working from home, the class sizes get even a little bit smaller. And then at the secondary level, if we divide those in half, the numbers get smaller again. And so, just on a very rough basis here, looking at the numbers per grade level, Adam Rundell tells me that in the elementary school, it's possible that those numbers could swell a little bit as he talks to more and more families. There might be a few more people that are feeling a little bit more comfortable about sending students in. So maybe our 30s go to like 33s or 34s, and those couple of 35s might get up near 40. But even so, we've got the space in that building to be able to do this distancing plan. So we feel like the plan that we've got, we're going to be able to accommodate this number of students. In the middle school, high school, the number of sixth graders that come in again will be 5 days a week. But for all the other classes, 7 through 12, we're going to divide those in half. Another thing that factors in for the high school students are those BOCES programs. We've got a combination of full day BOCES programs and half day BOCES programs. And so you can see some of those numbers below the high school numbers, where even some of those students that are reporting in person won't be in the Ovid building. They'll be off to BOCES. And so it'll lower our numbers even more. And so, if we're in a situation like on a Monday where, there are really only 10 juniors walking the building, that's a pretty low number to be able to manage. And so we think that we can distance these classes. We think that we can put together schedules for students that will feel good, feel safe, and be able to accommodate all of these rules. And so this is a slide that makes us feel like the plan is very doable. At the same time, we've got to account for all of those distance learning days, which I'm going to get into right now. All right, these are the busiest 2 slides in the program. If you think about our students this year, some of them will be working in person for at least part of the week, and many of them will be working from home. And so lots of questions about how one situation is going to be different than the other. I've already mentioned for the in-person students the number of days per week. We've talked about the screener tool. We've talked about the distancing and the PPE and the expectation for mask wearing. It's important for everybody to know we do get some questions about how we're going to enforce our rules in terms of mask wearing. And the answer is we have to be really, really serious about these rules. If health and safety is truly going to be the #1 priority for this plan, then one of the ways we've been saying this is different from the hat rule. If you've spent any time in our middle school, high school in the last 40 years, we've spent decades talking about hats in the building. Everybody knows that we have policy that says that you're not supposed to wear hats in the building. And for decades, it's been a constant back and forth between adults and teenagers and preteens about the wearing of hats. The difference with the wearing of hats is it doesn't come down to a life or death issue. And so when we process all of that and we go through all of the headaches associated with that, the last thing that we want to do is just send somebody home for wearing a hat where they might end up home for a while. That is not the case when we're talking about wearing masks in a pandemic. Our plan will mean that people indoors have to wear masks. I've already been fielding questions this summer about people that have come into our buildings and witnessed staff members not wearing masks in the buildings. And one of the things that people have to understand about that is that the capacity in our buildings in the summertime, the number of people that are in there, especially since we're not allowed to run in-person programs, with the small exception of special education, means that each department of staff has been a little bit more free to use their judgment about when they're wearing masks and when they're not. All of that is ending now. As we start to prepare for the beginning of school and we get into the period of time where there'll be more and more people in the buildings, every single person that comes indoors will be wearing a mask for the entire time, except for those special circumstances like eating meals, or if we're dealing with particular situations. I will say, though, that for people that will be in the building that for whatever reason can't wear a mask or need longer mask breaks, our system will take those people away from the general population so that we don't have everybody in a room wearing masks except for one person who's not wearing one. That's not a system that we can feel good about, and so we have to make different plans if there's ever going to be people that need longer mask breaks. I did get a question in the email group about what do we mean by mask breaks, and the easy answer to that is we want to give people the opportunity to spend some part of their day without the mask on. Mostly that means we'll be trying to spend time outdoors. When you're outdoors, if we distance properly, then we can remove the masks for a short period of time. Obviously, if we're going to be eating meals in the cafeterias, you're not wearing your mask while you are eating the meals. So that'll be an opportunity for people to have their masks off. We talked about some of the younger students who might need more frequent mask breaks. But the more and more we talk to people, even our student group that we met with over the summertime, some of the high school students indicated, hey, I've got a job where I have to wear a mask for 7 hours a day. Once you get used to it, you can do it. And so our bottom line system is going to be the masks are expected. Everybody's going to become familiar with Google Classroom, whether you're in person or not. The reason for that is so that we always have that system to fall back on. Even for those secondary students that are coming in person, you know that they're going to be remote for part of the week. And so all classes will operate with some level of remote learning available so that classroom resources are easily accessible. And we're going to spend a lot of time in the early part of the school year making sure that we establish all good lines of communication so that we know that we can fall back on this system when we need it. So that's going to be true for even the people that are in school. They'll all have the access to the Google Classroom, so we can always pivot if we need to. One of the things that we'll do in the in-person side of things is we're going to cohort students. This becomes really important in the situation where we might need to be doing any kind of contact tracing later for a suspected case or a confirmed case. We'd like to be able to say that in our system, any student in our building only had access or interaction with their peers, mostly from their own grade level. So another series of questions that we've gotten is about the students passing from classroom to classroom, or whether teachers would be passing from classroom to classroom and students would stay put. We want to leave open the possibility for students to move from one room to the other, but we're going to create little pods within the building so that, let's say that it's 3 second grade classrooms, and those 3 classrooms, as long as we pay attention to the good passing technique, as we go from room to room, they could move from those 3 rooms, but that's pretty much where they would be. And again, I have to say, we'll be thinking about those music spaces, PE spaces, a little bit more moving around in the building for those. However, we want to be able to say, in the case of contact tracing, that our students only interacted with other students in their own grade level and didn't enter spaces that hadn't been disinfected in between. So we're going to try to put that system together as best as we possibly can. We're going to limit the sharing of physical materials. You probably saw our message that we're going to supply school supplies for the elementary age students. I did get a question about school supplies at the secondary level. I'm going to turn that question over to Tim and Missy eventually so that they can address that with people. I should say also, that, as our time gets to the end for today's session and goes into tomorrow's session, we're going to make an effort to answer 100% of the questions that come in on that email account. You should get a personal response from the school if you write an email that answers each of your questions. And also the opportunity, if you want to talk to one of us. I'll just say personally on my end that anytime anybody wants to have a personal conversation about any of these things, then I'll arrange to make the time to talk to you and get questions answered in that format as well. One thing I should say, last thing on this half of the slide for the BOCES students, if they go to the BOCES campus, they're subject to the BOCES rules. So that'll be a new set of rules that you got to pay attention to if you're on their campus. Shifting over to the at-home students. Again, everything's going to be based on Google Classroom or some other platform. We're going to maintain super good communication with teachers. There will be the expectation that teachers are going to reach out live with their students every school day in some capacity. It's the way we're going to keep attendance for at-home kids. They're going to have to be present in their class somehow, whether it's a phone call or a video conference meeting for classes. They're going to have to be present so that their teacher can hear them speak. We're going to use this hear your voice method for accounting for attendance. Obviously, we're going to adjust for age appropriate limits. It's going to look differently for a kindergartner at home than a 10th grader. We want to make everything age appropriate. One of the lessons we learned in the spring was to pay attention to how much screen time we're asking kids and families to do from home. But mostly the most important thing is that we maintain good communication and that the expectations for students working from home are the exact same expectations academically as the ones for the students working in person. And we've been working very, very hard over the course of the summertime, getting ready for the school year to make sure that that's the case. So working from home or working from school is the same academic expectation for everybody. We'll be doing grading for everybody the way you're used to. So in the spring, we did just comment grades for pre-K through 8. We're going to go back to our regular report cards for everybody. And so grading criteria will be very clear for everybody. I'm going to try to make that clear up front for people so they know what to expect for in terms of workload, et cetera, et cetera. This second to last one here is really important. Everybody will have full access to our full support staff for all social emotional needs. It's fair to say that this is a really stressful time for everybody. And it looks different in different households. Different families are experiencing different kinds of pressures depending on where you work, how far you have to travel for work, what your childcare needs are, your unemployment situation if you're in that scenario, and honestly, just the stress of trying to do school differently. We're all used to school the way it was, and because this school year is going to be so different, it just change means stress. So that means that people will be stressed and they're probably going to need some supports. So right now on my screen, what I'm looking at is my full screen slide. So I don't know if Tina Halleck has joined the meeting. Is Tina on this meeting?
Yes, she's joined us.
I am. I'm here.
Hi, Tina. Could you just introduce yourself for the people watching and tell a little bit about what you do?
Sure. I am the family navigator. I've now been in South Seneca 6 years. If you don't know who I am or what I do, I want to invite you to go to the family tab on the website, and I have full descriptors about who I am and what I do, including a video. But essentially, I support families and caregivers, especially parents. And I would just echo, this is an incredibly stressful time for all of us. And I can be an outlet, someone to talk to. And I always say I help you hold the hard stuff. So especially if you're still making up your mind as to what you're going to do, I'm happy to be a sounding board to do that.
Excellent. Thanks, Tina. Just moving along here, it also is important for you to know Stacy's on this call as well. Stacy Clark, our Director of Special Programs. Her job is to monitor and help the special education staff and related services staff monitor all of the IEPs in the district. If your student has an IEP, then all modifications and accommodations are still in effect. And we're still conducting annual reviews and CSE meetings and making plans so that we can accommodate IEP students, whether they are in person or at home. Just quickly, let me look, let's glance together at this slide on our staff and our faculty. Again, we'll have some of them that are in person, some of them that are at home. The job descriptions are going to have to switch a little bit for staff that is working from home. One of the things that I keep communicating to the community is it's a reality for us that we have a significant number of staff that skew a little to the older side. So we have a lot of staff members that are over 50 years old. And as you can imagine, we've got a full range and spectrum of medical conditions to be thinking about. And so part of this plan is to keep our staff safe and to make sure that if they need to stay at home, they can do that and still contribute fully to our plan and our hybrid program. So, you know, a lot of the stuff that's on this slide, we've talked about already, the way it works in person. Basically, our teachers will see their class rosters of students if they're reporting in person. They're going to be the primary communicator to families. In the elementary building, you're going to be one or the other. So a faculty member will either be an in-person teacher or a remote teacher. So Adam is setting up essentially two parallel staffs. And the remote staff will work with remote students, and the in-person staff will work with in-person students. We don't really have that luxury in the middle school, high school. And that's mostly related to certification areas. We have to provide certified teachers for specialized classes. And that means that in the cases where we only have one particular teacher who's certified in a subject area, they have to be in charge of their entire roster, whether that roster is in person or at home. And so we're accounting for all of that with the plan. If you're an at-home faculty person, they'll be reaching out to your students every single school day. It's possible that we might modify that a little bit. So like in our master schedule, we're used to classes that meet on AC days versus BD days. So it's possible maybe that a particular teacher might say, you know, I'll be in touch with you on Monday, Wednesday, and Friday this week for this class. And other teachers will be in touch with you on Tuesdays and Thursdays for this class. And we'll set up a system like that. Once again, they're going to need to collaborate with one another so that we keep an eye on appropriate screen time. Part of the school experience has to be interaction with people. And so you'll be doing live meetings. But there's also a way that we can minimize that amount of time and then send you off to the work that you do. And you can even collaborate with your peers electronically to work on projects, et cetera, et cetera. But you know, we're going to have to be able to do this attendance system using voice contact. So you know, we're going to have to hear your voice in order to count you attending that day. In or at-home staff and faculty, they also will have access to our social emotional support system, and the expectation will be that they will be in person for our superintendent conference days. Unless they have a medical excuse. And so they won't be entirely at home. There will be certain parts of the school year days where the kids aren't in the building, where they'll come in and they'll do their professional development, et cetera, et cetera. We've been communicating to staff about what the expectations are. and teachers and staff members are making their final decisions this week, so that we can have the full plan in place. Last thing on this presentation slide, which is coinciding with coming up on 6 o'clock, are all the questions related to how we're going to be monitoring symptoms in the building. This flow chart is in our plan on the website. We are going to be in high coordination with Seneca County Health Department in order to implement this plan. So we've set up isolation spaces in each building attached to the nurse's office, so that if we need to isolate somebody who's got symptoms that are a concern, we can do that. For an adult in that situation, if they're able to get themselves home, they'll do that. Otherwise, we'll get them home or to a doctor. For a child that's being isolated, we'll call the parents to come and get them. And so then we can work with the medical professionals in order to monitor those symptoms and set times for when they can come back. Depending on the symptoms, if you end up in isolation, you might have to stay out of the building for a short period of time. If we have a suspected COVID case, that goes in coordination with the health department, and we'll handle those the same way that the health department has been handling suspected cases. It doesn't automatically mean quarantine for the entire household if a case is just suspected. Once a person gets tested, we wait for the results of the test. This is the way the health department does it. So we just follow their protocols. If we get a confirmed case, then that'll set a series of other decisions to happen. Number one, we'll do that contact tracing to determine who might have to be quarantined or isolated, who had contact with our confirmed case. But then there'll also have to be a decision about which parts of the program, or if the entire in-person program gets shut down for a period of time. Again, all of that will be in consultation with the Seneca County Health Department. This is what they do. This is what they have been doing for months. And so we've got really good coordination with them in order to do all of that. Before I wrap things up for today, the question about COVID testing itself, there is no required COVID testing that has to happen for the staff or the students. And so we don't have widespread COVID testing that's going to happen before school starts. All the COVID testing will be in reaction to suspected cases. And so having said that, it's also the case that anybody who works in the school system gets a little bit easier access to a test. And so we'll work with people individually to get them tested if we feel like they should be tested, or if they themselves feel like they should be tested. I'm turning to my helpers right now as we've hit 6 o'clock. Do you think that there's a particular question that I can answer quickly that I haven't addressed? Again, the promise is that even outside of these sessions, we're going to answer every single one of those questions individually to the people that asked them. And we're going to try, what we'll do between this session and tomorrow's session is look those over and have a little bit of a conversation to see if I should move some other things near the top of the list to talk about, to answer particular questions for tomorrow. So just looking around at my team here, anything that bubbles up that you think I should answer right now before we sign off for today?
No, I think we were just texting each other to the side with the questions coming in, and they seem more at the individual level. So I think it'd be just appropriate to respond one-on-one.
Okay, great. I'll say it one more time. We want to get all your questions answered, and if we have your contact information and you want to have a conversation with somebody, then we'll make that happen so that you can talk it out either with me or with one of the principals or anybody else that can answer your questions specifically. We'll be following up on all of that so that we get every question answered. I do understand that we didn't get to lockers and backpacks. In terms of bathrooms, there's a fair number of questions about bathrooms. We'll have a system for not overusing the bathrooms and giving free access to everybody to the bathrooms, and also enhanced disinfection for the bathrooms that get a little bit more use. So that's all going to be part of the plan as well.
Steve, I just wanted to mention that my extension at the high school and middle school is 3101. And that goes to my cell phone after a few rings. So I want everybody to know that they can get in touch with me. If you got a question for somebody and you're having trouble getting in touch with anybody, especially before school starts, just dial 3101 and I'll help you out.
Very good. All right, everybody, all the audience members, thank you for tuning in. And we'll do it all again tomorrow at the same time at 5 p.m. Send us your feedback in between, and we'll make adjustments that you think we should make. Thanks, everybody, for taking the time. I'm going to stop the live stream now.